Motherhood is such a beautiful gift, the ability to birth or care for a child with love. So many of us wish to have this experience one day, a space for families to grow, laugh, and create life. But this is not a reality for Black communities, for Black families, and Black women. Black maternal health is in danger. Black mothers are dying every day. Black maternal mortality affects Black women regardless of class or identity. Education and income do not provide true protection. Black women who continue to suffer at the hands of these systems have an increased risk of maternal mortality due to underlying undiagnosed preconditions. Racial bias causes mistrust between physicians and Black women. So to help tackle and get a true understanding of how Black maternal health is in danger, I set out to ask a few of my close families and friends on their opinions on Black maternal health and even their experience in medical industries and how they are treated as Black women. I set out to ask my mom, who is a mother of 2 children, a friend who suffers from endometriosis, and another friend who is a nursing student who is working directly with the knowledge and medical systems that we are using today. I set out to ask these 3 individuals on their opinions and how they believe Black maternal health is severely impacted by racial bias.
Black maternal health. Well, what comes to mind is healthcare for Black women and children.
When I think of Black maternal health, I automatically think of Black women who are seeking healthcare during their pregnancy.
So who is to blame? Bias and discrimination are 2 main factors which impact Black mothers' experience in healthcare. Dating back to the start of gynecology, maternal care, and slavery, Black mothers continue to be misheard.
And just seeing the disproportionalities between their mortality rates compared to other women, specifically white women, but even other women of color, you can tell there is a racial disparity there.
Now all of this discussion leads us to question, how might the high mortality rate of Black women be directly related to racist and sexist medical systems of knowledge which continue to suppress their voices and rely on outdated racial inequities to train healthcare professionals? So what are we discussing? Black maternal health specifically looks at the care of Black women and their interaction with the healthcare system. Black maternal mortality specifically looks at the relationship between social determinants, racism, and structures of health which lead to preventable deaths of Black women.
I feel like there's just that miscommunication and disconnect. Doctors of other races and ethnic backgrounds, because it's just there's a level of understanding that they just don't get.
People of color are not seen, or they're seen to be, oh, you're okay, what you're experiencing is not anything serious. And they experience a lot of neglect. Who gets access? Who's denied?
This is a main and key question in terms of training medical professionals. This is where gaps of knowledge and misconceptions lie. This is where Black mothers continue to fall through the cracks of healthcare. So what does this issue look like in medical environments and training medical professionals?
This is your field and you're supposed to be the one that's helping me, but instead I had to help myself because you couldn't take me seriously enough.
We know that there are structures that are preventing equity and equitable practices in healthcare. Yes.
As you can see, it is evident there is miscommunications, misconceptions, a whole bunch of things that are missing from the understanding of Black women's care. So why is this happening? There continues to be a lack of understanding of the various cultural and political determinants of health which impact maternal health and mortality. The lack of knowledge concerning Black women's care from the providers is a major contributor to the issue of Black maternal health. The knowledge needed to accurately represent and advocate for Black women's care continues to be dismissed and overpowered. The use of stereotypical notions from healthcare providers set up Black women for failure and neglect critical aspects of their maternal care. Now, when has this issue started?
Between 1835 and 1849 in Alabama, he operated on no less than 10 enslaved Black women without anesthesia. One enslaved woman named Narcha Westcott underwent 30 separate procedures, all without anesthesia.
Evidently, there continues to be a misunderstanding of how racism has severely impacted structures of health. Cynthia Prather et al. Argues that the encouraged use of experimental medicine on Black men's bodies dating back to slavery has encouraged their bodies to be viewed as subjects. This has forever changed the relationship between medicine and Black women. The legacy of racism is evident and continues to power healthcare for Black women. This deep-rooted history of slavery in conjunction with social determinants make Black women in particular more vulnerable to the contingencies of medical care. So let's break down what we have learned. In 2023, the World Population Review revealed that Louisiana had the highest rate of maternal mortality at the rate of 58.1 deaths for every 100,000 births. This rate is 4 times higher for Black mothers than white. So where are these misconceptions happening? The misconceptions about Black maternal health are occurring in the systems of knowledge and training of medical professionals, which continue to use implicit bias and racist stereotypes as systems of knowledge. Other misconceptions occur because Black men's voices continue to be dismissed throughout their pregnancy and the birthing process. The racist historical structures which have built gynecology allow for misconceptions to occur and lead to the preventable deaths of Black women. The voices in power need to step away and frankly be shut down to allow Black mothers' voices to step in.
When you come armed or prepared, the treatment is so different, I believe.
For years, they have tried to educate and train medical professionals on the right way to care for mothers. But these systems fail to realize that the continued idea of treating mothers the same cannot suffice anymore. Black mothers require specific care and attention. Black mothers being treated equally cannot happen if Black voices and communities and support systems are not involved in this process. It is in this process that Black mothers' voices are continuously left out of their care. This is where reconstructed, equitable systems of knowledge which recognize Black women and the various means of education to prevent their deaths. It is also important to look at how Black mothers and Black women are being treated in the healthcare industry today.
I have endometriosis, and it took me a long time to get diagnosed with that. It usually was chalked up to like, oh, you just have bad period cramps, when that wasn't the case. It took a really bad mental toll on me, and my OBGYN kind of chalked it up to like, oh, you're just a teenager, but I was having serious like side effects.
Well, I have a very close friend who unfortunately passed away. She was 9 months pregnant, having her second child. But throughout that pregnancy was very difficult. She was not living in Ontario or in Canada. She was living in another country, but, a first world country. And she complained many times of not being seen. And again, it was like, oh, these things happened. And unfortunately, she was rushed to the hospital to deliver her second child and had an embolism and died. And the child had to be basically ripped from her body. The child, fortunately, survived, but never got to embrace his mother.
In this country, where was it?
The United States of America. Yeah.
The political and socioeconomic production of knowledge is based on racist, stereotypical structures of Black women. The discourse on Black women, social determinants, equitable education, and training of medical professionals needs to change. Context matters in the creation of knowledge. Creating medical education systems which understand the various social determinants which continue to stack up against Black women, the various ways illnesses appear in Black women, and ultimately listening to Black mothers when they speak are 3 key and simple ways that the medical system needs to reconstruct their systems of knowledge that they produce. Specifically understanding how the lack of care for Black mothers and the access of systems of knowledge continue to dismiss their voices. The healthcare system continues to exclude Black women's voices from participating and advocating for Black mothers' care. They continue to be denied at the hands of the system in every single way. Knowledge is created to benefit those who pursue it. We would be doing medicine and ultimately Black women a great disservice if we fail to reconstruct these systems and knowledge that train medical professionals every day. Knowledge is an everyday making experience, and Black women deserve to live every day. We need to consider what it means to create knowledge and what it means to share it. What are the next steps? Who needs to get involved? Who can we look to for change? Who needs to step back? Well, we can look to include the introduction of organizations who are currently working in the U.S. to fight against these oppressive structures and advocate for Black women into medicine. They can serve as advocates, trainers, and educators to change the systems of knowledge in medicine. Several organizations around the world are working to recognize the disparities in Black maternal health and ways to overcome them. Black Mamas Matter, Soul to Soul Sisters, Ancient Song Doula Services, Mama Mototo Village, National Birth Equity Collaborative are just a few. So as I sit here telling you this information, sharing these stories, all I can think of are the beautiful Black women in my life and those who work to fix Black maternal mortality in the U.S. and around the world. We honor the moms who are here with us today and the ones who are not, working to break down barriers and bring ethical arguments in creating equitable systems of knowledge. However, this problem continues to persist at alarming rates. It leaves me to question, am I next?